Hello and welcome to episode 12 of Pelvic Pain Unpacked. I am so happy to be here with Dr. Theresa Litz.
Yay!
She is a sex therapist and specializes in helping specifically men who struggle with pelvic pain. And I met her at a conference a few weeks ago, and I'm really excited because the things she and her colleague had to say were absolutely fascinating. So, Theresa, tell me about your background and how you got into working with first sex therapist, because I know you were probably 4 years old and was like, I want to be a sex therapist when I grow up, right? And how did you specialize with pelvic pain?
Yeah. So I consider myself a licensed clinical social worker. So that's kind of my discipline. That's like the board that I go through for my credentialing, for my licensure. But I do specialize in in sex therapy and everything. So I do have my PhD in human sexuality studies. I'm also trained in EMDR and will soon be finishing up my supervision to become an ASEC certified sex therapist.
Wow. Well, now tell me what EMDR is.
Yes, EMDR stands for eye movement desensitization and reprocessing. It's evidence-based practice, particularly working with trauma. So I really like to bring that into my practice because I feel like, one, it's been very effective, especially when working with like pelvic pain and just trauma in general. But also, if you've done like talk therapy so much in the past, it doesn't require as much talking. And sometimes you can do a lot with very little, which I think is also helpful for some clients who it's just like, and we'll probably talk more about this, right? Where something happens and the body just sort of starts to react. And even though you might be aware of it and you're like, why is this continuing to happen despite maybe working with pelvic floor PTs and all of that, it helps to reduce some of that body activation that occurs. That can be really helpful. So in that first session, it can depend, right? We're going to have some of that policy stuff that we just have to check off. But the first few sessions, it's going to be a lot more but like history gathering, right? So like, how long have you been experiencing pain? When does the pain come up? What other treatment options have you tried in the past? Particularly, I really like knowing, like, is there anything that you found that does work, right? So it's just like, if you already have some sort of skills or resources that you like to go to, that's awesome. Let's build off of that. I also like to start slow. So depending on like how you're feeling, right? If you're really nervous right off the bat, we're going to take it slow. So we don't have to dive into if there was like significant trauma or significant trauma history. We don't have to just crack that open in the first session. We might not crack that open for the first few sessions. As we start to build that rapport, it's going to be more so of like, I really like to let people lead the session in some way. I'll provide some guidance, right? A little bit of a buffer, but I like to put, especially like my trauma clients, I like to put them a little bit more in the driver's seat because they've had experiences where maybe their autonomy wasn't honored. And that when we're working with trauma, we're working with pain. I want you to be able to build that skill of being like, you know what, not today. Because that also helps to like further on when we're talking about sexual assertiveness and sexual communication, right? Those types of skills are very transferable to be in that sexual space. And it's just like you're in the driver's seat, but also like you're determining our speed. And that's absolutely okay. And like you have the voice to be like, we're gonna push on the brakes a little bit. But also that gives you the space to be like, Theresa, I'm feeling really good today. Let's get some work done. It's just like, awesome. Let's go. Cause that also happens.
Oh, that's amazing. So it's just basically making somebody feel comfortable and feel safe and them being able to have some control over this rather than kind of being acted upon. Like, you got to talk to me about this, right? So
100%, 100%. Because I've had a client who didn't necessarily know that like my specialty was in sex therapy, and one of the providers was just like, "Oh, they're a sex therapist." And in our next session, they were just like, "I didn't know that." And I'm like, "Cause I'm also like, I'm a trained therapist just in general, right? Like I work with anxiety and everything like that. But it can be very overwhelming to like, once you really use that title of sex therapist, which is why I always leave with like licensed clinical social worker, to also bring down some of that nervousness.
So how do you help somebody with that pain avoidance mindset to kind of allow them to feel pleasure again? Is this one of the main techniques? The sense touch and the EMDR, are those your kind of two main go-tos to try to?
Yeah. In that, I'm also practicing, like, we're also practicing mindfulness. So that I feel like is a big one, especially when we're talking about that avoidance a little bit more, where it's just like what just naturally feels good outside of even like that sexual space and sexual behaviors. What feels good on the body? So sometimes too, just to kind of like desensitize a little bit, maybe like if you're practicing with like a vibrator or anything, you're using the vibrator like on your arms, on your upper thighs. Like we're not even like necessarily it's touching like the genitals or anything, just to practice some like just first touch to start to feel a little bit more comfortable and using different sensations to build that trust with the body. And
Interesting.
also with self-exploration. Sorry, I'm like going off on a few
I
different
love it. You
tangents,
go.
but
You go. You're the expert.
but with like self-exploration, right? That's a good one for avoidance because then you're driving
You're
the
in
car.
control. Yeah.
Exactly. And there's no pressure. No one is staring at you. You don't have to worry about like how a partner might be feeling in that situation. It's purely just you and your body. And you can take things as fast and slow as you want and really focus on like the intention and what you're experiencing within your body to rebuild that mind body connection as well.
So, do you see CBD as more of a tool, a bridge, or something else entirely in this healing process?
A tool. I feel like everything everything ends up being like a tool, right? So the work that like we're doing in session is a tool. The work you're doing in PT is a tool. So like the resources that we're discussing and like practicing, those are all tools. And CBD can also be that tool once again, because it can help to like create more of that positive relationship with physical intimacy and pleasure and allow the body to relax. Where it's just like mindfulness might work. It might be really helpful, but maybe CBT is kind of, once again, like that cherry on top that helps to just kind of help you get into that sexual space, get into that sexual mindset and be like fully present there.